I am a retrieval specialist with the aeromedical operations part of New South Wales Ambulance, and I'll just give you a bit of background about who we are. So we are critical care doctors and paramedics working on road ambulances and helicopters, and we also operate doctor flight nurse teams on fixed-wing aircraft. So with respect to COVID-19, our primary role so far in the COVID-19 response has been to assist in the even distribution of critically ill patients across our hospital networks. We do this by moving these patients who are critically unwell in an ED or an ICU, and we move them to another hospital ICU. This helps offload the pressure on these hospitals with high numbers of critically ill patients. This activity has increased over the last 3 weeks, and during that time, retrieval teams have transferred around 90 COVID-positive critically ill patients on ventilators between hospitals. We are increasing our capacity to respond by road and by air to regional and rural New South Wales in our COVID-19 response. So, no matter where or when someone becomes critically ill across our state, the system is and will be ready to retrieve those patients to the intensive care unit that they need. We are also assisting in maintaining regional intensive care bed capacity. The most common theme with these patients, as you've all heard many times at these press conferences and today, is a non-vaccinated status, and it's awful to see these patients in this condition. Often the people we are retrieving are young, they're previously healthy, and one that stands out to me was a young woman I recently transferred who had just delivered a baby. At the Aeromedical Control Centre, we have increased our medical specialist cover to assist in providing advice to doctors and to nurses in remote and rural communities 24 hours a day. All of these structures are in place while maintaining our ability to respond to non-COVID-related taskings as well. Lastly, can I just say how proud I am to work with a group of doctors, paramedics, nurses and aircrew who perform these roles in quite challenging circumstances. I view our role as not only a responsibility, but it's also a privilege to manage these critically unwell patients. I also have a very strong view that each member of the public also has a strong responsibility, and that is to get vaccinated and to do it now. Thank you.
Minister, it's a beautiful day today. Are you concerned about people flocking to the beaches and parks?
No, I'm concerned about people that are not vaccinated. I think that the fresh air is actually, we know it is the safest place to be at the present time. Dr. Chant and Dr. McAnulty and I've talked about that many times. So, but I would say to people who are out and about to maintain your social distance and to just be careful, because while we have many more to get to the required number of people who are vaccinated, we do have risks.